Now live, Supervisor, you can proceed.
Thank you so much, Stuart. Good evening, everyone. Thank you all for joining us once again. Before we get going, I would like to introduce Gilbert Martinez from our communication staff to share a message with our Spanish-speaking viewers. Gilbert?
Hola, buenas noches y bienvenidos a la sesión informativa organizada por la Supervisora Hopkins y la Doctora Mase. En esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretaciones al español. Para escuchar la versión en español, puedo usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Ahora regresamos para atrás con la Supervisora Linda Hopkins.
Thank you so much, Gilbert. I'm Linda Hopkins, Supervisor for Sonoma County's 5th District and Chair of the Board of Supervisors for this year. Welcome to our COVID-19 community briefing for Wednesday, January 13th. Our focus today, once again, will be on vaccine rollout in Sonoma County with an emphasis this time on strategies and communications about distribution. By the end of this session, we hope that you will have a better idea about how and when you might be getting your vaccines. And we also hope that you will be getting some of your questions answered live in real time. As a reminder, during this community briefing, we will be taking questions from the public. You can leave your question in the comments area of Facebook Live. I'd also like to remind those of us who are joining as panelists to speak loudly and slowly for the sake of our interpreters. We'll begin our update today with a brief presentation by Dr. Sundari Mase, Health Officer for Sonoma County.
Great, thank you so much, Supervisor Hopkins, and thank you everybody for joining us. I'm particularly grateful for your time today because we truly are at a dire point of this pandemic. We're still under a state-imposed stay-home order for the entire Bay Area, and we continue to see high case rates, and the chance of people testing positive is also increasing. Our local ICU capacity is down to 13.2%, while the Bay Area region ICU capacity is at 4.7%. The state makes weekly projections about what the ICU capacity will be 4 weeks from now, and the stay-home order will be lifted once that 4-week projection for the Bay Area region is greater than 15%. At that time, we'll be placed back into the purple tier of the state's blueprint for a safer economy. So we continue to see the climbing cases, more people in our hospitals, and while our staff is continuing with contact tracing, sheer numbers of daily cases is overwhelming our system. Here's where the good news is. We have the ability to slow this surge by following safe practices and abiding by the stay-home order while we get vaccines out as quickly as possible. Overall, the vaccine rollout is going really well in Sonoma County. We encourage everyone to take the time now to learn about the vaccine so you're ready when it's your turn. And that may come sooner rather than later. To date, we've administered 13,245 vaccines, and we expect this number to increase rapidly as supply and distribution grow. We are drastically scaling up our efforts to distribute the COVID vaccine, which is our most important tool to end the pandemic. You'll hear more about the efforts in collaboration to speed up vaccine delivery this evening. So I'll wrap up by saying thank you to all of you that continue to stay home and stay safe. And I'll hand this back over to Chairwoman Hopkins. Thank you.
Thank you so much, Dr. Mase. I'd like to take a moment to introduce a few of our panelists who are here with us today. We've got quite a lineup today of local experts to speak with us about the vaccination rollout here in Sonoma County. In addition to Dr. Mase and Deputy Health Officer Dr. Kismet Baldwin, we will also be hearing from Dr. Urmila Shende, who has just been named County's COVID-19 vaccine chief. We will also be hearing from Dr. Joshua Weil from Kaiser and Dr. Chad Krilich from St. Joseph, as well as Judy Coffey from Leap Solutions and Paul Gullickson, our communications manager here at the county. I'd like to start by introducing formally Dr. Shende, our vaccine chief. It's really good to see you and really nice to meet you, Dr. Shende. It's the first time I think we've gotten to have some FaceTime as well.
Nice to meet you as well. Thank you for the introduction. My name is Dr. Urmila Shende, and I will be working closely with Ken Tassif on implementing our vaccine strategy in Sonoma County. And that includes strategy regarding the distribution of the vaccine, as well as coordination on vaccine administration, interfacing with our healthcare partners and other stakeholders in the community, and trying to coordinate a smooth delivery, because the big question right now is, how can I get my vaccine? Where can I get it? There are a lot of questions associated with this. So we're going to be working hard to try and answer these questions and have a smooth system so that this rollout takes place smoothly over the next few months.
Thank you so much, Dr. Shinde. And I believe that you have some exciting news to share regarding what we saw happening at the Sonoma County Fairgrounds today. I'm wondering if you could share a little bit about what was going on at the fairgrounds. How is it going, and how does that kind of set the tone for vaccination rollout and implementation into the future?
Yeah, so it was our first big event at the fairgrounds. We were able to start a program where we vaccinated a number of our county employees, and it was in coordination with Safeway. And we will be continuing that process as we roll out further events at the fairgrounds. So at this point, we have identified a few different locations in Sonoma County. So this is the first event that we had, and it will continue. So we're looking forward to it. And the community can expect that we will continue to have these events as time goes on.
Thank you so much. And, I want to acknowledge that this is a fantastic first step, although, we have a very large sprawling county. Are there other locations that we are looking at potentially using to ensure that we've got, geographically equitable sites distributed around the county?
Yes, and in fact, I might add in Ken Tassif. I think he's on the call as well. He can talk to some of those issues.
Yes, thank you, Dr. Shende. I appreciate it. My name is Ken Tassif. I'm actually the Privacy and Security Officer for the county, the Healthcare Privacy and Security Officer, the HIPAA guy. And but during this pandemic, I've acted as the Logistics Chief and now the Vaccine Mission Manager to help operationalize the support systems that we're going to try and put in place for the response, working very closely with Dr. Mase and Dr. Shende. So some of the things that we're doing right now is putting together vaccination centers that are able to support others in their ability to deliver vaccines and administer vaccines. Right now, and by Friday, we should have the infrastructure in place, for example, at Grace Pavilion to have up to 1,200, actually more than that, vaccines a day to be delivered by various healthcare providers. In addition, we have a second site at the Santa Rosa Junior College at Petaluma in the fitness center there. We have several lanes there to deliver over 300 doses of vaccines a day. And up at the Huerta Gym, we're working with the town of Windsor to open up another center there. In addition, we've been working with the other partners to help support centers that they're working on right now in other parts of the county. For example, one in West County that I just got off the phone with one of our partners over there. So there are a number of, and we do plan on then finding a spot in Sonoma Valley, as a matter of fact, to support this. So what these are places where providers who don't otherwise have the space or the resources or the logistics to provide or to do vaccination administration, they can go there and they'll have the support that to do their job.
Thank you so much, Ken and Dr. Shende. And I don't think that I mentioned, Dr. Shende has been a pediatrician in Sonoma County for more than 2 decades, and really appreciate you introducing yourself, Ken, as the HIPAA guy is how I think of you in Sonoma County government. But both of you really stepping into these roles and having those deep relationships in the community, I think enables us to hit the ground running in partnership with our healthcare providers. So I really just want to say thank you so much for your service. Is there anything else that, Ken or Dr. Shende, that you feel like we should know? What should residents know about the vaccination plan going forward? Of course, with the announcements that were on the table today from, both the federal and state government, urging local governments to work on vaccinating folks over the age of 65, this also becomes a supply and demand issue, right? Of, at what point will we have sufficient vaccine to really get it out the door? So could you sort of comment on that over 65 piece, and then also just what you think is the most important thing for Sonoma County residents to know right now? Oh, and you're on mute, Dr. Shinde. There we go.
Yes, yes. Yes, I think you brought up the most important issue, which is that even though the recommendation is that anybody over 65 should be receiving the vaccine soon, the supply is just not there. And I think that over the next few days, 2 weeks, we will be able to start receiving more vaccine, first from the feds and then from the state, and then with allocations to us. And as we have more information, we will continue to roll out that information to everybody else. At this point, we have to keep in mind that the vaccine supply is going to be the rate limiting factor.
Yeah, and actually, Supervisor Hopkins, if I can just jump in here, I think it's really important for everybody to know that we have a really good plan in place at the county, working with all of our partners to ensure a seamless, efficient rollout of vaccine to everybody as your turn comes up. And we want everybody to know that even though the vaccine doses are coming, come every week, and we're notified on that week as how many we get. As we get this vaccine, we are working very closely with our large hospital partners, with our federally qualified health centers, with numerous different groups that have been identified to vaccinate. And we just learned today, for example, that our EMTs, that is emergency medical technicians, have been approved to vaccinate. We just learned a few days ago that our dentists have all been approved to vaccinate. So we have more and more groups joining the vaccinating effort. We are going to call upon them to come out and work in the locations that Ken is setting up, and through the strategy and prioritization that Dr. Shinde is working on, to get everybody in there when your time comes. So just stay tuned, and we'll get through this.
Ken, do you have anything to add, or Dr. Shinde? Oh, Ken, I think you're muted. I know you've got dueling screens. There we go.
Yeah. No, I just wanted to add, beyond setting up for infrastructure and so on, there are so many other areas that we're helping out healthcare providers by listening to what their needs are and then reacting as quickly as possible, whether it's recognizing that they need maybe different types of needles to administer for certain groups or whatever, and finding ways to help them get those resources to keep them doing what they do best and doing it efficiently and fast.
I really appreciate that. Well, thank you so much for the information, and I'm sure there will be questions from the audience later for all three of you, but I'd love to invite Dr. Joshua Weil to the virtual table, an emergency medical physician at Kaiser Permanente. And I know that Dr. Weil, you oversaw personally the evacuation of the Kaiser Hospital 3 years ago during the Tubbs fire. This is obviously a very different kind of disaster, being a very sort of slow-moving crisis, but one with critical implications for our healthcare system. From your perspective, how are things going at Kaiser in terms of handling this latest surge in COVID cases?
Well, thanks for the introduction. And I almost feel like in some ways that's a loaded question, because the context is that across the country, right, we're nearing 400,000 deaths. Millions of people have been hospitalized and ill, people out of work. So I can't just say things are going great, but within that context, I think we have handled things well in Sonoma County. Certainly at Kaiser Permanente at the hospital, we have been well prepared. We've had time to move through this in different stages. Initially, there was a lot of concern and much that we didn't know, and we've learned as we've gone, and we've had to be nimble and flexible. We've embraced different ways of care delivery, relying a lot on telehealth and other ways of getting care to people safely. We've managed the hospital flow. We've kept our members and our staff safe by making sure that we have the PPE that we need, and making sure that we embrace the new policies and practices as they come out. So overall, again, within that context, I feel like we've had a very strong response. I think we're lucky to be in Sonoma County. We've had great leadership from Dr. Mase. And I think, we are part of, Kaiser Santa Rosa is part of a larger organization, Kaiser Permanente, that has a lot of experience over the decades working with infectious disease. We were a major player in the Ebola preparedness response. We have nation-leading experts in our organization, and so we're very fortunate to have those kinds of resources to rely on.
Thank you so much, Dr. Weil. And I'm wondering if Dr. Chad Krilich, the Chief Medical Officer for St. Joseph's Health, would mind turning on his screen. There you are. Good to see you again, and thank you so much for joining us again this week. I'm wondering if you could provide a little bit of input on how St. Joseph's is handling the surge.
Yeah, no, thanks for asking. And I really appreciate Dr. Weil's comments. I think, part of what is helping us to move through this most recent surge is having partnerships like we have with Dr. Weil and Dr. Mase and other organizations within Sonoma County. And to that end, what we've been able to work through is a period of time where other parts around the country weren't surging, were surging, I should say, and we weren't, is doing what he had referenced, and that is learning and becoming prepared. Because now we're in a place, albeit we're not having 50% of our patients in the hospital with COVID like Southern California. We are seeing a larger volume of patients, as Dr. Mase referenced, than we have ever seen before. And so to that, it is really important that we continue to adhere to those things that reduce the likelihood of spread. All that being said, being a part, just as Dr. Weil had referenced Kaiser, of a large organization like Providence St. Joseph Health, one of our hospitals in Everett was the first hospital to have a patient with COVID in it. And to that end, knowing that we're parts of large organizations and their shared learnings, I think it has really positioned us well to the point in time where we're at now, when we have a COVID patient in our facility, that we're able to provide exceptional care to them.
Thank you so much, Dr. Krilich. And to check in on the vaccination at St. Joseph's, how is that going with respect to staff vaccinations, and have you started reaching out to members yet?
Thanks for asking. Yeah, for our vaccination process, we're following the same plan that I had shared with this group last time. Our goal is to start being able to vaccinate patients that are part of St. Joseph Health Medical Group by the end of January. And we have reached out to patients this week via email. They'll also be receiving an additional communication this Friday, so that we can start to make sure that we have the right patients coming in for vaccination, making sure that we're not jumping the line and we're getting those folks that are higher risk. And as Dr. Mase referenced, really simply targeting those patients that are over the age of 65, and then being able to get them in the queue to get vaccinated. As it relates to our caregivers, we've already started our process in getting those second doses of vaccine into our caregivers. So we have over 500 at this point in time, which is really good progress. So we're looking forward to finishing that part of the vaccination process and then moving to that 1B category, where, as we've heard more recently, our patients within St. Joseph Health Medical Group that are over the age of 65.
Thank you so much for that information. And I'm wondering if Dr. Weil, if you might share how Kaiser Permanente is standing on these fronts in terms of vaccinating staff and then looking ahead to vaccinating members.
Yeah, great. Thanks. So I think similarly, we have been very pleased with the rollout for the staff vaccinations. So far, we have over 80% of our staff vaccinated, and actually, I think approaching 40% who've had their second vaccine now. And the great thing about that is it's been a test run for the processes that we'll use in rolling out larger numbers of vaccines to our members and folks in Sonoma County. I think it's important to point out, as Dr. Krilich was talking about, is that we're kind of part of the entire system. So Dr. Shinde was talking earlier about the work that's being done at the fairgrounds and other sites that the county will be opening up. And Kaiser Permanente, like St. Joe's, will just be part of that overall plan to get 500,000 people in Sonoma County vaccinated. And I am pleased with the way things have gone so far. We have developed very efficient processes and effective ways of keeping people socially distanced, which is one of the challenges, right? When we're going to move people through, it's not like influenza where you can just line people up, but you have to maintain space, and you have to watch them for 15 minutes to make sure that there's no untoward reaction. So it is a very complex process. You also have to schedule the second vaccines. And so we're working as part of that entire system to make sure that we can get 500,000 people vaccinated. And the one thing that I think is important message is that we have to keep people remembering to be patient. So we are outreaching. We have a plan to outreach to our members. We are certainly updating our websites with all the information as it becomes current. But the reality is that we're being inundated by calls and emails requesting the vaccine. So I think that's great because it means that people are wanting the vaccine, which is our way out of this pandemic, as Dr. Mase mentioned at the beginning. The only way we're going to get through it is through vaccination. And so I'm very pleased that people want the vaccine, will be willing to get the vaccine, and that we are going to put the systems in place to get vaccines in arms. But we're going to have to be patient because even if we can execute on 5,000 to 7,000 vaccines a day, you can do the math. That's going to take us, 5 months to get 500,000 people vaccinated.
Thank you so much for that information, Dr. Weil. And I know that Dr. Krilich mentioned that, St. Joseph's is proactively already reaching out to members, sending emails. How is Kaiser going to handle that communication flow with your members?
So similarly, so many of our patients are active on what we call kp.org, which is, we can send them out emails. We do that every year about influenza and every time, the seasons change, time to get your allergies. And so we're sending out similar messages about getting COVID vaccine. And then we will also be specifically reaching out to those patients that fall into the various categories as the state and the county open up those tiers. So we will be reaching out to those patients as well through those systems and through calls. And then again, there are systems in place for people to be able to call in and schedule their appointments.
Thank you very much for that information. And thank you also for reminding folks to be patient, because I think that's a very important reminder. And, just speaking personally as someone who is not at high risk for COVID-19 complications, my biggest fear is not actually me getting the disease. It's actually me infecting someone else who is high risk. And I personally will sleep so much better at night knowing that when I go to the grocery store, that clerk who's checking me out is protected, or that when I go to the doctor for a routine visit, that physician, is taken care of. And so I hope that those of us who fall into those lower tiers, to me, I get hope just hearing those numbers, like 40% of Kaiser, already getting their second vaccine. That's what I want to see. And I'm happy to wait my turn in line until it's my turn so that you all who are on the front lines can get vaccinated. Since we are on the subject of communications, I would now like to introduce Judy Coffey of Leap Solutions. Leap Solutions is partnering with the county to take on the huge responsibility of connecting with various stakeholder groups in the community, including business leaders, nonprofit, labor representatives, and other sectors, particularly kind of gearing up towards the next phase, right, 1B, and those stakeholders that are going to be eligible for the vaccine soon. So the goal is to make sure that everyone understands and has an opportunity to engage in the vaccination rollout, and that those community leaders can provide feedback in real time so we can troubleshoot, because we know that this process is not going to be perfect. We're going to just keep trying and doing the best we can and respond in real time. Now, Judy, your background and skills certainly make you uniquely suited to help with the engagement on the vaccine rollout. You were the Senior Vice President and Area Manager of Kaiser Permanente right here in Sonoma County, and now you work with Leap Solutions. So I'm hoping that maybe you could tell us a little bit about your plans to engage with community leaders and stakeholders, just to ensure that we get outreach everywhere in the county. We know we're a big county with lots of different subpopulations and communities, so this is a challenge, but I feel better knowing that we're in your capable hands. So tell me what your plans are.
Thank you very much. Scott Omeron, who's a partner of Leap Solutions, is also on the call. As well, that the supervisors, the press Democrat, all the different county departments have been receiving numerous requests from across the county about what's the rollout, when am I going to get my shot, when's it coming, all the logistics of the rollout. And in order to really help try to condense all this information, Leap Solutions has been retained by Sonoma County to help roll out information. And the information is fluid. Just today, this morning at 7:30, it changed about the age, which you've talked about, over 65. And so there's just a lot of information that's going to be going out. And so we are trying to work with certain segments, not the general public, just Sonoma County leaders, in certain industries. And they will be called like stakeholders. So if I gave you an example, I would say, let's say hospitality or tourism, something like that. There's several people out there. And what we want to do is get these individuals the same information at the same time, and even on a weekly basis, let's say, so that a leader can then, we can form an outreach committee, which will provide advice and support and help these individuals understand that it's going to take time. And they heard the word patience, and I would say patience. We have to go through our tiers, and information is fluid, and we need to just continue to remind people that they will get their vaccination.
Thank you so much. So some of the examples of the kinds of stakeholders that you would be working with are sort of membership organizations, right? Or labor organizations. So, someone's a member of a labor union, their representative might have a seat at the table, or someone's a member of, say, Sonoma County Farm Trails or Farm Bureau or Community Alliance with Family Farmers. And so then it's basically one more way for, those individuals to get information through that membership organization or through that leadership group that can then disseminate the information out to everybody. Is that kind of what you're getting at?
Yes, that's correct. And remember the numerous nonprofits we have in Sonoma County, same way to get them the information. I think that's imperative, that everyone kind of gets the same information. And like I said, it's going to be fluid and it's going to be changing. Therefore, we're going to be having weekly meetings. We have another one. We have one scheduled tomorrow and one scheduled next Wednesday. And just trying to get out the most current information and letting people know that it's going to be happening, but it's going to take time. You heard Dr. Wiles say, if we did X amount so many times a week, it would take good 5-6 months. So, and I think just letting people know how much vaccine, you hear what comes out in the news that there's going to be, X amount of vaccines hitting the California. Well, how much goes to LA? How much goes to San Francisco? How much ends up in Sonoma County? And then how much goes to different areas? Just getting people perspective.
I think that's a really important point. Yes, is that, we are a humongous state and we have a lot of other more dense urban areas. So even if you hear millions of doses coming into California, does not mean millions coming to Sonoma County. Can I ask what's the best way for leaders of stakeholder groups to get in touch with you so that they can take part in these meetings? And anything else you think folks should know?
Sure. There is an email. I'm going to have to ask Scott because he set it up. I think it's outreach@leap.com. Is that right, Scott?
It's outreach@leapsolutions.com.
Right. And there's a phone number, and then there's the email, which will go out, and that's how people can go ahead. And it's out because we've been getting a lot of stuff today already. So it's out there.
Great. So outreach@leapsolutions.com. Was that the right one?
Yes.
That is correct.
Perfect. And I'm sure that we can share that information, via social media in the comments too, if anyone missed it.
Yes,
thank you so
please.
much, Judy. I'm really excited to work with you going forward and appreciate bringing that capacity and the deep knowledge you've got into the county process. And
Great,
now
thank you.
I would like to introduce who I think is a familiar face to everyone, which is Paul Gullickson, our County Communications Manager. Paul, I would just love it if you could give a quick rundown on what's the best source of local information for how people can get real-time information about vaccines, and then your thoughts on how the rollout is progressing here in Sonoma County. I think it is important, as everyone has said, Judy just said, the information changes on a daily, sometimes hourly basis. So, by the time you get the next paper in the morning, yesterday's paper has very, very dated news sometimes these days. So tell me a little bit about real-time information.
Yeah, thank you, Linda. Thank you for giving the 2 minutes here just to give a plug on what we have on the county website in particular, because we are getting a lot of questions, but we do want the public to know what information is available out there, so they might be able to get some of their questions answered before they call, their primary care physician or the county or even the 211 line. But we do want to encourage people to go to socoemergency.org/vaccine. That's socoemergency.org/vaccine. It's a vanity URL that we've set up that'll take them directly to our vaccine information pages. And if you will let me, I'm going to share my screen so I can share with our viewers as to what they'll find when they go to that page. They will find a lot of good information here. And if I can scroll down, here we go. one of the main messages we want to let people know, as you'll see it here in bold type at the top of our vaccine update, that individuals who are eligibly vaccinated should first contact their healthcare provider or primary care physician for information on how they can receive a vaccine or make an appointment. But in general, we have information here that can help them understand more about the vaccine and how it's going in terms here in the county. And the first thing they'll encounter is this chart that shows how many vaccines we've administered. As Dr. Mase reported earlier, we've had 13,245 administered, 8,690 Pfizer, 4,555 Moderna. But more than that, they can show how many we've distributed by date. They can also go down and shows we have little graphs that show how many have been administered by date, and that's a helpful tool. You also see what we call our rainbow sherbet graph here that shows really where we stand in our rollout. And as you can see right here, it is kind of bracketed here that we're somewhere, but some are right at the end of the tier 1 phase 1 group. Some are starting to are right in the middle of tier 2, but it basically gives you an idea of where we are as a county in terms of going through the various phases of the distribution plan. It also shows who's in what phase each group, and particularly there's a lot of interest in those in phase 1, and you click on here, it takes you to a page that shows you a little more detail about those populations. Now we have to update this information based on the directives we got from the governor today that everybody 65 and older will be considered as the high priority group, but we'll be getting that information updated as well. That's in there. And then when you go down the page, you'll see links to various pages of different information about the benefits of getting the vaccine, all about vaccine safety, some of the information out there that there have been people who have about allergic reactions, those who have had traditionally allergic reactions to vaccinations in general, and it goes into detail about what those are. It also goes into some of the myths and misconceptions about vaccines. So I encourage people who have questions about it to go there. Key facts about the vaccine, and then the information about what to do after receiving a vaccine. Talks about some of the side effects. Some people may experience small amounts of pain and swelling, and what to do. How to respond to that. When to call your doctor. Information about scheduling a second shot. So it goes into. There's a lot of information here that we want to make sure that the public knows about, and there's also frequently asked questions. And that doesn't even count all the other information about testing and COVID and whatnot. And this will we'll continue to expand this website as we go along. So I'm going to stop sharing there.
Wonderful. And I think that's probably a good segue. I think it's time to turn over to audience questions. And I do want to acknowledge that we do have some other panelists who didn't present today. I know that Director Robinson is also on the line, and there may be others if I scroll through my squares as well. So we've got lots of folks who would be ready to answer those questions. So take it away, Paul.
Well, first off, as we expect, a lot of people have questions about the new directive from the governor about vaccines, those 65 and older now being part of that priority 1A tier 1 group. And many of them are really phrasing the question as how are those 65 and older going to get the vaccine? Should they go through? Should they contact their doctor? Will their doctor notify them, or should they just go to one of these clinics they're hearing about and wait in line? Can they expect to be served there? Dr. Mase or Dr. Shinde, do you want to address those questions?
Yeah, thanks very much, Paul. It's a great question because we know that extending the vaccination to those over 65, that is 65 to 74, opens up another huge number of people. So I think the state is thinking about good ways in which we can operationalize this as we are in the county. We're not quite there at phase 1B tier 1 yet. So just hold tight. We will get into mechanisms, way for people to get their vaccination, whether it be through your primary care provider, whether it be through one of our multi-specialty hospitals, whether it be through the public health route that we've already spoken about. So I think it's a matter of just getting an implementation process in place. So just hold tight. And like I said, we should be there hopefully in the next 2 to 3 weeks.
Yeah. But most of these clinics are designated for certain people, as I understand, and many of them, they are making appointments. So we are asking people to just follow that for right now, and we will get you information. We'll get to you as soon as we can, but it does depend on how many, doses of the vaccine that we receive. The next question is really on that line.
Paul, if I can jump in, that's a really good point. As I've always said throughout this process, really depends on two things that we don't have the full details of: how much vaccine we're going to get for distribution, as well as how many people in each group want to be vaccinated.
Well, that's a really good point. And it leads to the next question. One of our viewers, Christopher, has done some math for us. He said in the first 26 days, the county vaccinated 11,631 people. At this rate, given our population, we won't be completing vaccinating everybody until somewhere till the end of 2023. How can we move this a little faster, and what's the holdup?
Yeah, it's a great question. Thank you for that. We are ramping up our efforts. This is the first 3 weeks of implementation of vaccination for Sonoma County. We're actually already doing more vaccinations than we were initially. And I will stress that you can see that we will continue to perform more vaccinations over time, hopefully exponentially, actually. As you heard earlier, if you were on the briefing the entire time, we are setting up 18 to 20 lanes, similar to OptumServe, for vaccination in different sites throughout the county, where we can start serving people quicker and faster, more seamlessly, and do have, as I already said on this press briefing, new groups that are being licensed for vaccination. For example, our EMTs and our dentists. And it's going to be sort of, boots on the ground, everybody contributing in the community to get the vaccinations done. I don't know, Director Ross, do you want to add?
Yeah, Dr. Mase, if I may add, we are in ongoing communications with the state regarding this very issue, and working with the state to identify additional resources and supports that can be brought into the county through statewide to help support our efforts so that we can expedite our process for administering vaccination. So more to come on those reports as we move forward.
And as always, we want to emphasize that the county is not directly administering any of these vaccinations, that we're facilitating the distribution of these vaccines and setting up these clinics. But we are, that's basically our role is not in the administration of the vaccines themselves. We have a couple of our media partners with us today. I want to start with Phil Barber of the Press Democrat. Phil?
Thank you. Paul, can you hear me?
You're on, we hear you.
Great, thank you. Dr. Mase, do you have an estimate for how many people in Sonoma County are now included in Tier 1B with the addition of people 65 and over?
Yeah, that's a great question, Phil. Let me turn this over to Dr. Shinde or to Ken, because I think we have some preliminary estimates. Over 65 might be somewhere around 40,000 or so. Dr. Shinde, do you have that number right off?
Unfortunately, I don't have that number. I know it's significant, of course. I don't know if Ken, do you have those numbers?
I apologize. I don't have that number right off the top of my head.
Yeah, you know what? We can find out for you, Bill, and get back to you. We did look at the last census. I want to say it's about 40,000 people over 65. It could even be 50,000. So it's a large group for sure.
Thank you. Paul mentioned the vaccine website, and I know there's a lot of interest among our readers in that data. One question that we get a lot, you're updating daily on doses administered, but the data doesn't include doses received by the county. People are interested in what sort of proportion are being doled out. Do you have numbers on how many total doses the county has received, how many it currently holds, and do you know how many might be in the next shipment?
Yeah, it's a really great question. Thank you, Phil. We know exactly the numbers of doses we receive in public health, but vaccine is not just coming to public health. It's also coming directly to our hospital partners and directly to CVS and Walgreens for vaccinating the long-term care facility staff and residents. We don't have updates on exactly how many doses are coming to non-public health partners. I do have our lead epidemiologist, Kate Pack, who's on the line. I don't know, Kate, if you want to add to my answer about tracking of the numbers of doses coming to the county.
Hi, yes. So that is an area we're looking to start posting some information on the website. Starting tomorrow, we're going to be gathering information from healthcare partners about the doses that they're receiving each week and the doses that they've received to date. And we have our numbers from public health. So we'll be able to post information about that. One area that is a little bit harder to track are the doses coming to CVS and Walgreens because that's managed at the federal level and we don't have as easy of access to that data, but we do plan to share information on everything that we can get locally about doses coming to the county.
I appreciate that. And if I could just clarify one more thing and then I'll let other people get involved. That vaccine dashboard that we're talking about, the total from yesterday of 13,245 cases, or excuse me, doses administered. I just want to be clear. Does that include doses administered through our local hospitals? Is that number being tracked in that data, or is that excluded?
If I can speak to that. So those numbers are all from the California Immunization Registry. And so that includes doses administered by the hospital. Eventually the data from the administrations through CVS and Walgreens will feed to the state and then to that registry. Right now, that data reflects doses through that have been administered through those that were given to public health and to the hospitals.
Great, thank you very much.
Okay, we had a couple of questions about the drive-through clinics that are operational now at the fairgrounds. One related to, are those being vaccinated being told which vaccine they're receiving? And also, how are you observing the if there are any adverse reactions post-vaccination at the fairground drive-through center?
So I'm going to turn that over to either Dr. Shinde or Ken Tassif, as they've been more involved with the fairgrounds process.
I'll go ahead and I believe I can answer that appropriately. When a person is given their vaccine, they're also given a card that describes both the type of, or whether it's Moderna or Pfizer. And they are also, that card tells them the lot number, so they know which dose to get for the second time. The second thing is they have a staging area where they park for 15 minutes, and there is an observer that is going up and down that line, talking with people and making sure that they are fine.
That's great. Thank you, Ken. I wanted to back up just a second to respond to a question Phil had about the website. I just want to let him know that we are adding material to the website, and we're building in more information that we hope will actually show not just the number of doses that have been administered, but how many we're receiving. And we're working on creating other features, including adding a feature which will allow a search engine tool where people will be able to plug in their personal information, and they'll get their answer will tell them when they can expect to when they can expect to get a vaccine, and who they should notify in order to get the vaccine. So I just wanted to add that we continue to work on those features and added data on that site. Let's go to Martin Espinoza. Martin?
Hi, everybody. Hi, Dr. Mase. So Dr. Mase, I have been talking to owners of residential care facilities who are extremely concerned and sort of going out of their minds because they can't get any answers from Walgreens and CVS or the State Department of Social Services Community Care Licensing or the Ombudsman. I understand that you had a meeting with some of these facilities and the Ombudsman, Community Care Licensing as well yesterday to talk about these issues, and they're very frustrated. We're now moving to a lower priority population, and these people still have not gotten their vaccine. This is the population that you and I have talked about for months that is extremely vulnerable. They comprise most of the people that have died, and they're stuck waiting for a vaccine because of what appears to be a federal contract that took this thing out of our hands. What would you say? What do you say to these people?
Yeah, Martin, you have a really great point. I think it is a very, very important group that we reach and get vaccinated. We have had actually a call with our ombudsperson and with other providers of care that are stakeholders in this process. CVS and Walgreens, we have a spreadsheet showing exactly all the facilities that are signed up for vaccination through that process, the state process that is. Mm-hmm. Also have dates of when those vaccinations would happen. If there are any facilities that are not on that list, then we will pick up the vaccination through some of our partners for that group. But at this time, it looks like most of those facilities are on the list with dates for vaccination for the first, second, and potentially third visit to that facility. So we are waiting to see how that process goes and how it flows. I asked the state of California whether they think that we should speed up the process. They agree. They are going to discuss with their partners how to get that sped up.
Do you know, so you have a list of all those scheduled visits? You have a list of all those scheduled visits. How far back are those visits being scheduled?
Well, for the skilled nursing facilities, of which I believe there's about 22 in our county, we have a list of those that signed up, which is almost all of them, and dates for the first, second, third, and in some cases, 4 different visits to ensure that everybody gets a first and second dose. And it looks like many of those are signed up in January for getting the first dose. So we're waiting to see how the implementation phase goes. And as I said, have already put forth a call to the state to be on sort of on board with us in case we need help in that realm.
Yeah. And Martin, this is Kent Hassif. One of the things that I found in helping stand up the OptumServe sites is these providers, as they learn the process and get that down, they ramp up very fast. I remember putting in the very first lane with OptumServe back in May. And now they move very quickly, and we're up to 7 lanes now in the county. We have the third most number of lanes in the entire state. Only San Bernardino County and LA County have more than ours. And that's attributed to their ability to learn quickly and start moving much more quickly. So I believe, while I can't speak for CVS and Walgreens, I believe my experience has been that these providers start gaining momentum and things move very quickly once they get find that momentum.
I have a follow-up question for Dr. Mase about an outbreak over at Sonoma Specialty Hospital, where I'm told that almost a dozen patients come down with it, lots of staff. Can you speak to what's happening over there? And I do believe you're working with them to deal with that.
Yeah, Martin, as you know, we can't speak about any specific facility. Generally, if there's any outbreak in a congregate setting, we are involved. We are giving guidance and recommendations for testing, for contact tracing, investigation, isolation, quarantine, all of the things that we've been talking about.
Thank you. I have more questions about the vaccination of skilled nurse of residential care facilities, but I can ask those tomorrow.
Okay, thank you, Martin. We are getting some follow-up questions about just as specifics. If we have a number of how many vaccines that we have now that have not been administered as yet, do we have a number on that?
Let me turn this over to Kate to see if we have an idea of that.
I think that's information that we're going to be sharing as we get the information back from healthcare partners about what they have left in their supply. So we'll be able to share more on that hopefully by Friday.
Yeah, and just to let people know, there's always a delay in the tracking of the efforts that are going on. So the vaccinations given, for example, in the last 24 hours may not, or even 48 hours, may not quite be in the system yet. We get a lot of our data from the database and it lags. So just to let you know, the numbers that we put up on the dashboard are often underestimates as to what has actually been supplied or given. In other words, how many vaccines have gotten into the arms of people is probably less than what we put on our dashboard.
Okay. Just a couple more questions.
I should say more than what we put on our dashboard. That is an underestimate.
Right. Yeah. Just a couple more questions. I know we're getting near the top of the hour, but Jen, one of our viewers, asks, are volunteers needed to help administer the vaccine? And if so, how do they step up?
Absolutely. Thank you for asking that question. I think this is a great forum in which to invite anybody who is licensed to provide vaccination to step up and volunteer. And Paul, maybe you can give the specifics of how people can connect with us.
Well, the easiest way is to reach out to us directly at publicaffairs@sonoma-county.org. That's publicaffairs@sonoma-county.org. Send us your information. We'll put you in touch with the people that could most use your help. So we'd be happy to be a conduit for that. And then the final question I have here is concerns how will teachers be notified when they're eligible? They are in that 1B tier. How will they get notification?
Yeah, thanks for that question. We're working really closely with SCO, the Sonoma County Office of Education, and Dr. Harrington to ensure that we have a seamless process for getting teachers vaccinated and all staff in our health, in our school system. So just stay tuned. That's probably going to be happening. Well, it's phase 1B tier 1 is where education comes in. Right now we're planning with SCO to start that vaccination process in early February. So just stay tuned. There'll be places that are set up, vaccinators, and a schedule.
That's great. And that's actually a great segue to our next meeting a week from tonight at 5 o'clock, when our theme will be focused on reopening schools. And our superintendent of instruction, Steve Harrington, will be joining us at that time. And we can go into a little more detail as to what that looks like and what the governor's plans are for reopening schools. So with that, I'm going to hand it back to Supervisor Linda Hopkins, and thank you all for answering the questions.
Thank you so much, Paul, and thank you to all of our panelists for joining us tonight. I also want to say a special thank you to Jordy, our Spanish interpreter, and Elizabeth, our ASL interpreter. As a reminder, you can always find us on Facebook. We'll be back here, as Paul mentioned, same time, same place, and focusing on schools reopening next week. Take care and be well, and have a good night, everyone.